want to thank you both for taking the time from your busy schedule just to come to our offices at Shelter Afrique. You brought your executive team here, your communications team. To us at Shelter Afrique, we're very privileged that you've been able to take the initiative very seriously. I think for us, as you know, this is not the beginning of the interaction that we've had with KEMRI. I have to say, your team came through when the pandemic was not a pandemic, when the World Health Organization was not involved at the time, just to come and to educate the staff of Shelter Afrique on what are the precautions to be taken in terms of trying to prevent the spread of coronavirus. I can recall the professor came in and discussed issues around hand washing, issues around the wearing of masks, issues around social distancing, and also that helped because with the team that you brought to Shelter Afrique, people were now more informed about how best to handle the coronavirus. And I'm pleased to report that through these preventative measures, none of our staff at the moment have tested positive in terms of the coronavirus. Of course, it's a global pandemic, looking at least 3.2 million people affected by the virus, looking at 228 deaths. I mean, we are talking numbers, but numbers don't mean anything when you're talking people. And to record that in Kenya to date, we've had 15 people die. That is something that we as Shelter Afrique take very seriously. So this partnership between researchers, medical researchers, biochemists, I have to say myself, I was never good at the sciences. That's why I stuck to the financials. I'm an accountant, but bringing accountants together, professors, medical officers, including the chairman, it tells you that when we have problems in Africa, in tune with our own traditions, we have to come together as a family and say, how best do we solve and resolve these problems? So we want to commend also the government of Kenya. It appears on the face of it that we are managing to manage this pandemic when you look at the rate of recoveries in excess of 129 recoveries. However, going forward, we do believe that as Shelter Afrique, if we don't support the ability for you to test, if we don't invest in the testing mechanisms, we may have people moving around and we may have numbers that are understated because people have just not been tested. So we as Shelter Afrique are humbly making, of course, a donation to fund at least more than 1,000 testing kits, so that so that the work that you are doing and the work you are supporting the hospitals can also increase and support your capacity. Of course, we believe the pandemic is not just a viral disease, but we believe it's a social disease, and we as Shelter Afrique want to make it clear that we want to find a way where we can support civil society and support government and the public sector. I have to say that as Shelter Afrique, we're in the business of financing affordable large-scale housing. Now, why is that important? It's because we believe that if we spend more of our focus on investing in low-cost, high-volume, affordable housing, we won't have the number of slums that we have. So part of our program is to look at how do we upgrade slums, because it is very, very inconsiderate to ask people that stay in one house, 5 or 10 in a slum, to exercise social distancing. It's not pragmatic at all, but we need to find more long-lasting solutions to address that. But just before I close, I just want to say that we as Shelter Afrique, on behalf of our board chairman, Dr. Steve Minder, we've also looked at how do we provide food. So next week we are providing food to quite about maybe 3,000 families in Machakos. There's a slum there where we're providing food relief packages. That's why you find on the T-shirts, it's actually relating to the food.
KEMRI greatly appreciates this privilege in terms of KEMRI's core mandate, which is a lot of people think that KEMRI is there to just conduct research, but our core mandate includes not just conduct of research, but also being able to use the results of the research to support our communities, our countries. There is a component, first of all, of capacity building. We recognize that based on the experience and the resources we have, we can contribute significantly in terms of capacity building. And what our team came here last month to do is essentially to enable Shelter Afrique to ensure that they are safer during this climate. So capacity building is another another area that which is one of our core mandates. But equally, the other role that we play is to provide service. To provide service, and in terms of providing service, we are now involved not only in supporting the ministry and the counties in terms of the actual investigation, including the conduct of surveillance, inquiry, but also the testing, for the organisms that are responsible for many of our conditions, particularly those that cause epidemics and pandemics, this global pandemic. From inception, KEMRI recognizes that partnership is very central. Partnership not only with global stakeholders, but stakeholders at the national level. And the opportunity you have given us is to be able to partner with yourselves at the local level, at the national level, and we appreciate very much the partnership, the opportunity we had to send the team here last month was really the start of that partnership. And we have no doubt that others will learn from you of how you benefited through this partnership, and they will give us an opportunity also to provide that support. So partnership is very central, and we would like to extend this appreciation for the opportunity to begin our partnership with Shelter Afrique. You can share this with the board. My friend, the board chair, Dr. Steve. I was actually looking forward, not just to come and receive it. No, listen, seriously.
No, you're right.
I told the DG yesterday I'll come and greet my friend and tell him we appreciate this partnership. So we would want you to extend our appreciation to Dr. Steve for this opportunity for us to partner together.
Thank you.
And he knows who was coming here. It is it is us, and he knows that I'm for the time being the chair of the KEMRI Board of Management, and I know that when we come here and when we leave, that will be the end. You are likely to forget. so we wanted to leave this bag here. It has our name. In search of better health, but there are a few things inside. One of the things is for those of you who are able to read, we have some of our publications that tell you about KEMRI, and we have these documents, and we have a notebook here. I know that you may not want to use it openly, but you can use it privately because yes, KEMRI, you may not, I'm sure you want to use books, notebooks that are labeled shelter free. But finally, from our production unit, because in terms of research, innovation is a core area, and we have come up with a number of products, and one of the products is currently very much in the market, and we have that product essentially in two forms, as a gel and also as a spray. So you have it as a gel and also as a spray. So we want to give this in memory of our being here. So I want to pass over this to you. One of the things that you hold there, I know that we are. Thank you very much. Thank you very much. Thank you very much.
Thank you, Chairman.
I should have
Can you
sprayed this.
spray? Can you hold the other one?
Spray.
The other one. I can actually spray.
Oh, that's
You can
spray.
actually spray that.
Yeah,
See,
I
so-
can.
Just spray several. Just press it several. Sir.
That's a
Yeah,
gel.
that's okay. That's okay. This is a gel.
That is a gel, but
Yeah,
this one,
Yes, yes, the spray.
this one is a spray.
Yeah.
Thank you.
Yeah. When you handle the money, thank you very much. Thank you very much.
So we will not buy this from anywhere else now. We will just buy from Kenya. because at the end of the day we have assurance. Right?
Yes, yes.
That it's coming from the right place. The spray, the what. So we will Honorable DG will actually put an order through.
Yeah.
When we'll speak to our head of HR.
Thank you very
So
much.
that this we can proceed.
We actually are very happy to be in this family that is supporting KEMRI to produce the kind of innovations that we have made in KEMRI. And we want to assure you that this gesture will be actually taken care of very well to make sure that it goes to achieve what it is intended for. So we want just to appreciate that and thank you very much again.
Sure.
And we look forward to this continued partnership. Thank you.
It's important.
Are you ready? Yeah.